Hey, everybody. Thanks so much for joining me here. We are going live to Norton Healthcare today, where they're giving us an update about flu and COVID stats in our area and testing and getting care and where folks should go.
For associated illnesses. So one of the things as well here at Norton Healthcare, we have a number of options. One is our Norton Care product, which is basically the ability for individuals to use telemedicine, to go online, seek an appointment with a provider, and have a discussion about care. The other is through Norton Prompt Care. Those are located within the Walgreens locations here within Louisville, and those appointments are also available online. And those tend to be for those illnesses for individuals who feel like they need to be tested to determine if they have flu, COVID, or RSV. And then our urgent cares, which also offer a next level of care for those individuals who think they might be having some risk but need a physician visit as well as some medication associated with that. And then lastly, is the emergency department. And as I said, those really tend to be more evaluations for both shortness of breath, significant symptoms related to chest pain. We want to make sure those patients get evaluated. So, we all learned through COVID a number of ways to protect ourselves and to protect others, whether it's feeling comfortable masking, it's washing your hands, isolating. Those things all continue for these same three viruses, and we want to make sure that we're doing everything we can to protect our family members, our friends, and that isolation is incredibly important if you're feeling ill. So just sort of some opening comments, but I'm happy to take questions or anything specifically that you might have about what's going on in the community or within Norton Healthcare right now.
So, Dr. Hester, I'd like to revisit RSV because I know that people have been talking about the triple-demic of flu, COVID, RSV, and we know that RSV can affect small children and older adults. What about those in between? Can they still get RSV?
They can, and as you said, the small children really birth to 2 years old have the highest risk for RSV. RSV is a little similar in COVID that you can get it more than one time. Typically with RSV, if you get it a second time, the symptoms are milder. So as we age, we may get exposed to RSV, but we will likely have milder symptoms as we age. Now, there is again a risk for those who are over 65, maybe some other comorbidities, that they may have the risk for pneumonia associated with RSV. But typically, those individuals who are, between 2 and 65, you're typically going to find mild symptoms, but certainly an annoyance, but mostly related to cough, congestion, typical type cold symptoms.
So in most people, it's just going to look like a cold. So as far as testing, I'd like to go back to that. Does everybody need to be tested for all of these things?
No, I don't think so. I mean, I think that when you look at if you're a healthy individual who really does not have significant risk related to these illnesses, I think it's important to sort of find yourself at home, isolate, take some medications to help you from a symptomatic standpoint, and then just continue to drink fluids and get through this process. But I think certainly if you have some risks, it is important, or if you've had an exposure and need to make someone aware, that's an important component of that to discern if you have flu, RSV, or COVID.
Okay, and jumping into, let's say you are positive, what should you be doing at home as far as protecting the rest of your family, especially with holiday gatherings coming up?
Well, the most important thing is continuing to wash your hands. When you're touching things around the home, those put your family members at risk, as well as making sure you're trying to isolate yourself from them in a way that doesn't expose them to you coughing and getting secretions in the air for your family to get exposed. Those are going to be the two most common things. And so it really is just making sure you set yourself up to protect your family. And, we've all been through these experiences with the pandemic of COVID. And the good news is I think a lot of individuals have learned how to sort of manage those situations at home.
Do we think that some of what we're seeing this week is a reaction or from the holidays, from all the Thanksgiving gatherings?
Well, we've been seeing an increase for flu for some time. So I think that certainly anytime you put large groups together, you have that increase. But we've gotten back to, fortunately, from the early phases of the pandemic, we've gotten back to where individuals are having a lot of activities. And so it's not just Thanksgiving, but it's parties, it's gatherings, it's sporting events. And so there's going to be a lot of opportunity for individuals to have exposure, but certainly too, when you see, the winter, it's starting to get cold again. And so that drives more individuals inside. So I think it does put us at risk for an increased exposure, but certainly just making sure you're taking those precautions. And if you are an individual who's at risk, you may want to consider masking during that period.
Okay. Does anybody have any questions? Okay. I don't have anything in the chat at this point, and I don't see anybody unmuting. So I think that will do it for us today, and I will send everybody the recording. If you have any further questions, please reach out and I will get them answered.
Thanks for sharing the message. We really appreciate helping get the message out and just helping continue to educate patients. So thanks for your partnership in that.
Okay. Thanks to everybody.
All right, thank you for staying with me here on Wave Now, watching the stream from Norton Healthcare about giving us an update about the flu and RSV and COVID in our area. I know that my kids' school right before the Thanksgiving holiday was closed early because they had so many students and teachers out because of all the flu and stuff that's kind of going around right now. So I know it's impacting a lot of families. Want to give a quick hello to Carol Hess for watching this morning. I really appreciate you and for you to say good morning here from Tell City, Indiana. So thank you so much for always joining us and leaving us a positive message. Linda, I see your question right now. How long can these viruses live on surfaces? I am so sorry. If I had seen that question earlier, I would have asked it. So my apologies. I'm not really sure. So I don't want to lead you down the wrong way, but I'm sure disinfecting everything is probably a good idea right now. But thank you so much for joining us. We're going to have more on what Norton told us today coming up on Wave News later on. Thank you so much for joining us here. I'm Myra Ansari.